I'm LaShondra Shaw, PIO for the City of Austin, and I am the moderator for today's news conference. Spanish interpretation of this media availability is on ATXN 3. To start, Austin Public Health Director Stephanie Hayden will first say a few words, followed by Dr. Mark Escott, Interim Austin Travis County Health Authority. Then Janet Pichette, Austin Public Health Chief Epidemiologist, followed by Cassandra De Leon, Interim APH Assistant Director, Disease Prevention Health Promotion Division. We will then open it up to our pool reporter who will ask questions on behalf of the media. Stephanie, over to you.
I'd like to start out by talking about the holidays. As we know, the holidays are approaching us quickly. We know we have one coming up tomorrow. And my advice to everyone is please be as safe as you can be. We have our risk-based guidelines that are available for you to go on our website and look at that information. We want you to really gather with individuals that live in your home. We want you to continue to look at how you can establish new traditions. And for those of you that did not travel during the Thanksgiving holiday and you only had your meal with your family and you established a new tradition, my hope is that you will continue that. Also, it is National Influenza Vaccination Week, and we have to encourage you to get your flu shot. It is not too late for you to get your flu vaccine. If you want to, if you're underinsured or uninsured, please go to Austin, Texas /flu. If you have insurance, contact them and ask them where is the nearest pharmacy that you can go to get your flu vaccine. At this time, I'll transition over to Dr. Escott.
Good morning. I'm happy to say that I have received the FDA submission for the Pfizer vaccine and had the opportunity to review the document. That's a 53-page document. It's available publicly. And after reviewing that, I'll say that I am extremely impressed with the efficacy and the safety of this vaccine. Overall, the efficacy, the effectiveness of the vaccine, 94.6%, 95% for those individuals between the ages of 16 and 55. So much better than I think anyone expected it to be, but it is impressive. There are side effects associated, particularly after the second shot, but the indications, the data we have now are that those are relatively mild, that they are side effects that are commonly seen with other immunizations, like chills, like muscle aches, like pain at the site, like swelling. Really no serious or concerning adverse events that would give us pause in terms of encouraging the use. The data from the Pfizer vaccine is excellent. The data that we've seen so far for the Moderna vaccine is excellent as well. The other encouraging thing that we see from this data is the impact on severe disease, with only one individual in the group receiving the vaccine that had a severe illness. And it wasn't that severe because the person didn't even need to be hospitalized. So that's incredibly impactful. And I think that we're likely to see the FDA authorizing under the emergency use authorization this vaccine after the hearing tomorrow. With that, I'll turn it over to Janet Pichette.
Thanks, Dr. Escott. I'm going to basically be talking about holiday gatherings as well, and I just want everyone to know that we are definitely seeing the direct impact of Thanksgiving holidays on our case numbers. We are hearing story after story after story about families who gathered during Thanksgiving holidays. They allowed people who lived outside of their immediate home even if they were a family member, they didn't live in their home, coming in, having the holiday, and now, you know, multiple people are becoming ill with COVID-19. So I just want to emphasize to everyone, we are in a stage of widespread community exposure. People need to be very diligent in their face mask wearing, social distancing. If you become ill at all, you need to stay home if you're sick. Avoid touching your face and hands. And if you feel that you have any symptoms, even if you feel like it's allergy type symptoms and you have congestion or sore throat, you need to consider getting tested for COVID-19 to rule that out and begin your recovery. And with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet. And we're really excited to hear the news about a vaccine that is coming more and more closely to us, being able to distribute that at the local level. We know that we'll be seeing that within the next week or so. And so with that exciting news that we have a new tool to help us combat this disease, we're working with our vaccine coalition to really focus on key goals to protect our infrastructure so we can continue to treat individuals who have COVID-19, but then also others that are sick in our community. And then also really focus on those who are the most vulnerable from adverse health implications from COVID-19. And as we move through this, knowing that this new tool is available, we have to continue with our other protection controls of wearing our face mask, watching our distance, and continuing to wash our hands so that we can use all of those things to make sure that we are able to rid our community of this disease and get back to normal. And with that, we'll open up for questions.
Thank you. Now we will turn it over to our pool reporter, Tom Miller from KXAN.
All right, thank you. This first question is from us here at KXAN for Dr. Escott. We're wondering, what exactly did you tell Mayor Adler when he consulted with you about traveling to Mexico? And at any point, did you warn him of the risks or suggest it might not be a good idea to go?
The focus of my conversation was the same as the focus on dozens of other conversations and questions that I and the department have faced related to COVID-19 and events. And that is, you know, we've got to significantly modify events to be safer. You know, under stage 3, things were a little bit more flexible, but our advice has been the same. Outside is better than inside. Smaller is better than larger. You know, doing things with masks is better than without masks. And, you know, I think that it's important that we recognize that people all across our community have listened to the advice, have made substantial alterations to their plans in order to keep us safe. You know, I'm grateful, particularly to the mayor's daughter who, you know, probably wanted to have something larger than 20. I have a daughter myself. I know that 20 would not be her ideal wedding. But that's what we're asking people to do, to dig deep and to make substantial adjustments to their plans for now so that we can weather this storm, we can buy more time until we have a vaccine, and we can be past this.
All right.
I would just like to add, you know, the guidance, the risk-based guidance is not uniform for and it can be changed for different scenarios, but it's really important that people consult that risk-based guidance when they do make decisions about gatherings and other activities that they participate in.
The other thing I would like to add is that as Dr. Escott said and Janet Pichette, the risk-based guidelines is such a helpful tool. If we look at where we are right now in stage 5, individuals that are 65 years or older and individuals that have underlying health conditions, the risks are different for individuals that don't have that. The other thing is that we are always getting questions from individuals that are making decisions based upon what's in the governor's orders and what's also in the mayor's and Dr. Escott's orders. Our environmental health team has worked very closely with restaurants to ensure that if parties, come to the restaurant and they have more than 10 people, they have always had them to sit, only 10 is the max. And so these are principles that we have followed this entire time.
This next question is from KUT, and it asks, how soon can we expect people in the Austin area to receive the initial doses of the COVID-19 vaccine? And when do you expect to receive more doses?
Yeah, I'll answer that. We have received notification from the Department of State Health Services that Austin Travis County will be in receipt of about 13,650 vaccine as early as next week. That is contingent on the FDA's emergency use at the authorization. And so we are planning for, as that vaccine comes into the community next week, to anticipate that we'll start seeing vaccinations starting. Additional vaccine we expect will trickle into our community in the coming weeks following that. And we are making plans to receive that vaccine and deploy it.
And I'd like to just add, we just need to hold on a little bit longer and be patient. We know this is a very fluid situation, and we are learning every day a little bit more about the vaccine distribution and how it will impact our community. So we just ask for continued patience. We're excited about the prospects of beginning our vaccine delivery.
And I want to reiterate that our primary goal right now is to protect the hospital infrastructure, protect our healthcare infrastructure. We don't have enough doses to do that yet. That will include our EMS providers. Beyond that, beyond securing that healthcare infrastructure, our other major priority during these initial phases is to really prevent death and severe disease. And to give you an idea of how many people that is in our community, we look at individuals over the age of 80, that's about 30,000 people. Between 70 and 79, another 50,000 people. If we add 60 to 69, it's another 115,000 people. We've received, 13,000 or are receiving 13,650. So we need a lot more doses just to cover those who are at the high risk for severe illness or death. So as Janet said, it's going to be a while. If you're younger, under the age of 50 and healthy, it's probably going to be spring or early summer before it's likely that those individuals be offered a vaccine.
All right, this next question is from CBS Austin. It asks, are we seeing the predicted Thanksgiving increases in cases right now? The 7-day admission average is rising, and there are significantly more people in the hospital ICU ventilators than were on Sunday.
Yes, we certainly are seeing an increase. We've been seeing an increase over the past week in terms of newly diagnosed cases, admissions to a hospital, as well as total hospital beds being utilized. We had a significant jump yesterday in terms of ICU bed utilization moving from 75 to 82. So we are concerned. This is about the time we expect to see the hospital side of things start to be more significantly impacted. I think the next several days are going to tell us a lot about how significant that bounce will be.
And I'll just add, as I mentioned in my opening statement, that we are hearing story as we do our case investigation. Many of them are related to Thanksgiving gatherings, individuals who were family members that didn't reside in the household, who went to the household, and then moved on to another Thanksgiving party somewhere else. Entire families being affected by that exposure. So again, we anticipated that this would happen. We want people to be very mindful, as Director Hayden said. You need to be safe and practice holiday safety and continue having those gatherings, but keep it limited to those in your own household. Even though you may think the person in your family or friends that you are very close with are safe, if they do not reside with you, there's always a chance that they have, COVID-19 or they've been exposed, and you just need to be very careful.
All right, this next question comes from KOOP Radio, and it asks, last week you reported that there were not enough rapid tests on hand to cover AISD schools. What have you heard from the governor about this since announced rapid testing program that will relieve this shortfall and also allow broader testing to first responders and the general public?
I'm not aware of any new supplies, since the governor's announcement. We have received an additional allotment of rapid tests that were utilized for the AISD testing. We're hopeful that those rapid tests will continue to increase so that we can provide that rapid test and rapid results to help us better navigate. We certainly are expecting that supply chains will improve, in the coming months, and we look forward to transitioning additional testing strategies to those rapid tests.
Okay, this next question is from Fox 7. We are seeing more gatherings at hotels and weddings, likely due to pandemic fatigue. How are contact tracing efforts going with these?
So, again, as our case counts begin to increase, they become pretty unmanageable from this standpoint of our primary focus will be on doing case investigations. That's how we get contacts. Some of the challenges we anticipate happening are a lot of people who are investigated, and when asked if they can provide their contacts to us, are refusing to do so. And we've seen that specifically this week related to holiday gatherings and weddings and things like that. So it's something we've struggled with from the beginning of this pandemic, people not being forthright with information, which is very important to us to follow up. So again, as we get into community-wide transmission and it begins to increase at a higher level, it becomes more challenging to effectively do contact tracing, because we're very focused on doing the case investigation and identifying specifically information related to those newly identified cases.
We've also asked, we really need people to cooperate and to provide information so that we can manage this disease. We have unprecedented outbreak right now in the United States, unprecedented numbers of deaths, and we need the public support in those case investigations and contact tracing. We cannot manage the disease without that support. But if people still refuse to provide that information, it's essential that they themselves contact individuals who they encountered and tell them that they've been exposed. It's the right thing to do. It's the moral thing to do. And we've got to continue to work together as a community to control this outbreak and buy us the time that we need to get enough folks vaccinated.
All right, this next question is from Community Impact. Can you share which area hospitals will receive allotments of the Austin area's first vaccine shipment this month? Do you know what percentage of the 13,650 initial doses each facility will receive?
So that information was released via press release, I believe, from the Texas Department of State Health Services. We can certainly provide that list it provides the allocation for all the hospitals across the state that were identified to receive vaccine with the breakdown of how many doses each of those facilities will receive. In discussions with our healthcare executives, it's certainly not enough to vaccinate everybody in the hospital. It's going to be enough to vaccinate those who are at the highest risk for exposure in the COVID-19 wards, in the ICUs, and probably in the emergency departments as well. But they certainly do need more vaccine. Right now, the estimates is that maybe 50% of those hospital employees may be able to be vaccinated, but we're still trying to get better identification of those numbers.
All right, this next question is from Univision. On Monday, officials stated being concerned with the number of ICU beds available. If we continue on this upward trend, do you think we would be moving patients to the convention center?
So our ICUs have plenty of capacity. There was a report yesterday about the ICUs being at 83, 85% capacity. That's normal capacity for our ICUs. Our hospitals don't operate with a lot of redundancy in beds, particularly in ICU beds. So that's well within the normal limits of what we normally expect to see this time of year. We still have hospitals performing elective procedures, so we haven't pulled that lever, which we could do if ICU admissions start to rise and things get a bit tighter. And we saw back in the spring that turning off or turning down those elective procedures can build additional capacity in the ICUs very quickly. But right now we're in a very good situation. Our hospitals are open and operating normally, and we will continue to monitor that situation to ensure that we have the capacity that we need.
It is going to be important for individuals to really monitor their behavior because it is our behavior of not practicing safe health practices that can land us to the hospital. So we want people to make sure they are watching their distance, make sure you are wearing your mask, staying home if you're ill, washing your hands, and if you have symptoms or have been exposed to someone that has symptoms or COVID, please get you a test. We've got to stay the path.
All right, these are our second questions from the media outlets. So we're circling back with KXAN. And I just wanted to ask a follow-up question to Dr. Escott about the mayor and his trip. Do you believe that it was appropriate for the mayor to travel when he did? Was that your recommendation that would be an okay thing for him to do?
So again, we didn't have specific discussions regarding trips. But I'll say that generally speaking, our guidance at that time at stage 3 of risk did not include in avoiding travel for those individuals who were in the lower risk category. Had the mayor asked me, I would have said that our guidance says that it's okay if the people who are traveling fall into that lower risk category. Obviously, things have changed significantly since the beginning of November. That guidance now would include to avoid those kinds of trips. So from the public health standpoint, it was not inconsistent with the guidance at the time.
All right, thank you. This next question is from KUT Radio. It looks like they left their column blank. So we'll move ahead to CBS Austin. They are asking, is Austin-Travis County still taking patients from other parts of the state? And are we part of the plan for rural communities like Bastrop County, which saw a 300% rise? Where does the Austin Convention Center figure into this?
So our hospitals are still receiving requests for transfers. But again, that's individual hospitals deciding whether or not they have the capacity and the staffing to take on folks. They certainly have taken on COVID patients and non-COVID patients from some of these other parts of Texas that have been hit hard, such as El Paso and Lubbock. The ACS is really designed to care for low acuity patients. And that means patients who are sick and need hospitalization, but they don't need a lot of care. So this may be individuals who just need some supplemental oxygen and need some monitoring, but not intensive care type of patients. When we talk about surge for intensive care, that involves care within the walls of the hospital. So building additional capacity at those hospitals themselves if it's needed. Again, right now we don't have any indication that in the next several weeks we're going to need to utilize the ACS. But it's critical that folks understand that things could change very quickly, as we saw in the catastrophic surge in El Paso and Lubbock, in surges right now in Abilene, Midland, Odessa, Waco, certainly increasing cases in Dallas, Fort Worth, and San Antonio. We must be very careful, and we must continue that caution until we can get the vaccine in sufficient supply to make a difference.
Thank you. This next question is from KOOP Radio, and it asks, the U.S. vaccine chief stated that the vaccine was the light at the end of the tunnel, yet the New York Times reported that vaccines will be much less effective if they are introduced into a population where the coronavirus is raging. What is your estimation of the effectiveness of the vaccines in Central Texas?
Well, I think here in Travis County and in Central Texas, vaccines will be very beneficial. Again, when we look at our active cases over time, we are at the bottom of the major metropolitan counties in Texas. That means we haven't seen huge surges of coronavirus here, which means we still need the vaccine. In places where there has been substantial surge, like El Paso, the efficacy may be less, or the vaccine may be less impactful because so much of the population has already been exposed. The percentages here, are going to be in the neighborhood of 5 to 10% of individuals having had COVID-19 when we consider the ones that we know about and the ones that we probably don't know about. So we still have a long way to go, long gap to fill between that 10% and the 70% that we would need to have herd immunity in this community.
And I would just like to add, to make sure that Austin Travis County continues to be best suited for getting vaccine and flattening the curve and getting us protected, we've got to continue to maintain our infection control measures. I know we've said that a lot already, but that's essential to make sure that we continue to flatten the curve and we protect as much of our population as possible so that when vaccine becomes widely available, that we can really use that as an additional tool to get us back into normal operations and get us all protected. So continue to wash hands, wear masks, stay home when you're sick, and watch that social distancing.
All right, this next question is from Univision, and it is our final question. Can you explain what have been the side effects of the second dose of the vaccine? And when would we be getting this second vaccine in our area?
So the anticipation regarding the second vaccine, the Moderna vaccine, is that it's going to lag about a week behind the timeline for the Pfizer vaccine. So we're still waiting to hear about the approval process for that and in information regarding how much of that vaccine we may be able to see in December and January. The side effects are things like chills and muscle aches, in a smaller percentage, there are individuals who develop a fever, somewhere in the neighborhood of 15% from the second dose. You know, other common side effects like headache, like pain at the site of the injection. Those symptoms tend to be higher in number in younger age groups, so the under age 55, and less so in the older age groups. But overall, very mild symptoms, and consistent with the side effects that we've come accustomed to from other types of vaccines.
We also know that the Centers for Disease Control and the Department of State Health Services are putting systems in place for us to report side effects or any adverse effects. But we also know that what's been reported so far related to the vaccine trials is that the side effects are nowhere close to the types of adverse health effects that we are seeing with COVID-19 disease. So as Dr. Escott said, those side effects tend to be mild and should not be a deterrent from getting the vaccine.
Thank you, everyone. At this time, we will have our closing remarks. Stephanie?
As we enter our holiday season, we know that Thanksgiving is behind us. So as we press forward this week, we have another holiday tomorrow. And so I encourage you to really plan. Think about how safe you can be. Think about your new traditions that you have established that have worked well for you. But I also want you to think about a tradition that may be an old tradition that has not worked well for you or someone that you know. We have all been personally touched by COVID-19. And so we have to do everything we can do to be as safe as we can. So over the next, 6 months or so, we've got to stay the course. The vaccine is coming. We're very excited about the vaccine, but we know we are not going to have enough vaccine to provide everyone initially. So it's going to be important to wear your mask, watch your distance, make sure you stay home if you're ill, wash your hands. Last reminder, please get your flu vaccine. This is National Influenza Vaccination Week, and we encourage you to get your flu vaccine. Austin, Texas /flu if you're uninsured or underinsured. If you have insurance, consult your insurance and find a pharmacy nearby or your primary care physician and get your flu vaccine. I'll transition over to Dr. Escott.
Thank you, Stephanie, and happy Hanukkah early to our Jewish community. Again, celebrate, but don't celebrate too much. We have to keep those precautions in to ensure that we can celebrate in future years, in future holidays. So please be safe. Again, the FDA submission has been forwarded. It is 53 pages. There's a lot of data, and the data is showing that this vaccine is very good. The effectiveness of it is around 95%. The safety profile is very good with significant adverse events less than 0.05%. So very impressive data. It is going to require 2 injections. The efficacy, how well it works at 95% is only after 2 shots. So it is important and will be important that folks understand they must get both shots in order to be protected at that level. We look forward to receiving additional doses of vaccine. But as Director Hayden said, we have to stay the course. We have to continue those protections. We can see the light now, but it's still in the distance. So we have to keep vigilant at least through the spring and probably early summer. And
I would just like to add that, following Thanksgiving, we've seen a number of cases that have resulted from holiday gatherings, individuals celebrating who didn't live in your household, and you need to be very careful about hosting those types of gatherings to protect those in your home and protect people outside of your home as well. We are in a position right now where we have widespread community exposure going on. So I want to remind people that as you go about your day and try to get those essential things done in your household, like when you go out shopping, and if you go out for food or whatnot, you need to be very, very vigilant about using your prevention measures. As you've heard time and time again, even today, you need to make sure you cover your face. You need to avoid confined spaces. You need to avoid crowds. Exercise and use your own personal responsibility. So if someone encroaches in your area of your personal space, that you can back away, but make sure that you have your mask on and you're keeping your social distance. Again, I think it's important that we practice those prevention measures, as well as washing your hands, as Director Hayden said, and staying home if you're ill. This is going to be critical. If you do come down with symptoms of any type, you need to go ahead and make arrangements to be tested, because we are in that period of cold and flu season where there are a lot of COVID-like illness symptomology out there amongst the community. So stay safe, Austin. That's my best advice.
And I would just like to reiterate, so many of us in the Austin Travis County community have been personally affected by COVID-19 disease and our families. And it's a hard time because we're wanting to celebrate these holidays and gather, and we've been in quarantine for so long, or lockdown, or whatever else terms we're using to describe our experience right now with being safe with the virus. And as the vaccine becomes more available, we are excited, and we're hoping that also continue to look towards a solution. We encourage that right now, empower themselves with knowledge that's available, and as we get more information, we'll be sharing so that you can make this just yourself and your family. Until vaccines ready, and until enough of our population has been vaccinated, so we can give them again important that everyone follows this practices to stay safe, so that again we can rid this threat from our community. Thank you.
That concludes our media availability for today. Thank you to Director Stephanie Hayden, Dr. Mark Escott, Janet Pichette, and Cassandra De Leon, and to our pool reporter, Tom Miller from KXAN. Thank you for joining us, and have a safe day.
All right, everybody. Will Dupree once again here in the KXAN live studio. Thanks again for watching this stream as we carry this news conference that Austin Public Health has held each and every week for the past few months, talking about the COVID-19 response, what's happening in our area, and sharing the best safety protocols. I want to highlight some of the things that they talked about just a few moments ago. If you happen to miss any part of their conversation, a lot of people are wondering when Austin Travis County is going to receive shipments and distribution of the COVID-19 vaccine that's currently awaiting emergency usage authorization from the FDA. That's first from Pfizer, which is a 2-dose shot, and then also from Moderna, which is just one particular shot. We are still awaiting that emergency use authorization from Pfizer and Moderna. However, Pfizer looks like it might come within the next week or so. And from the State Department of Health Services, Austin Travis County is expecting to receive about 13,600 initial dosages of that vaccine. Again, it's uncertain when that's going to come, but that will first go to healthcare workers and health facilities to get those particular populations vaccinated because they had the most direct exposure to the novel coronavirus. Wanted to highlight that. Also, we have talked for a long time about the impact that Thanksgiving and people gathering together for meals and celebrating the particular holiday, what impact that's going to have on the outbreak in our area. And they said just a few moments ago, those experts were saying that they are seeing case investigation revealing that family get-togethers, friend get-togethers, gatherings with loved ones have led to an increase in cases. What's discouraging to those experts is that people are not willing to share their contacts after they have gotten a positive diagnosis of COVID-19. So what these experts are wanting to do is to contact people so that they can find out that they have potentially been exposed and then they can get a test and protect themselves, but people are not willing to share those contacts. They obviously would like people to be as cooperative as possible with those investigations, but if they are not, Dr. Mark Escott, the interim health authority for Austin-Travis County, did encourage people to do some of that themselves because he said it's the moral and right thing to do to let people that have been around you know that they potentially have been exposed to COVID-19, and it's really as a matter to protect themselves and their health. We will wrap up everything that was discussed in that particular news conference here in just a moment on our website, kxan.com, and on the KXAN News app, so please download that if you've not done so already. Thanks again for watching our stream, everybody. I'm Will Dupree here in the KXAN Live studio. We'll see you back here another time. Please stay safe, stay healthy, and take care.